Hello guys. Today I'll be talking about the respiratory symptomatology. The respiratory symptomatology is very important during your case presentation in your final exams. So, I'll be teaching you one by one symptomatology, which is most important for your for your viva and also case presentation and also for treating patients also. Okay, so first one, we'll see what is cough. Okay, cough is nothing but the sudden and a variable expiratory thrust of air from the lungs through the air passage associated with phonation, which momentarily interrupts the physiological pattern of breathing. So it sounds so weird to buy at all these things. No, so you just remember what is cough. Cough is nothing but it's a sudden forceful blowing out of a air from lungs. Okay, to clear the mucus, dust, smoke from your air passage. So it may while doing this, it may produce you sound and it may disturb normal breathing for a moment. So that is called as cough. So you have classification of cough. So basically we have acute cough, subacute cough and chronic cough. Acute cough is between, if it is lesser than 3 weeks, then you call it as acute cough. If it is between 3 to 8 weeks, then you call it as subacute cough. And if it is more than 8 weeks, then you call it as chronic cough. So what are the causes of acute cough? Remember, the respiratory causes. What are the respiratory causes of acute cough? The respiratory causes of acute cough are tracheobronchitis, bronchopneumonia, viral pneumonia, acute on chronic bronchitis, pulmonary embolism. What about sudden onset? Bronchial asthma, asthmatic bronchitis, coughing cough, foreign body. So remember only this much. So tracheobronchitis, bronchopneumonia, viral pneumonia, acute on chronic bronchitis, pulmonary embolism, bronchial asthma, asthmatic bronchitis, coughing cough, and foreign body. So this comes under the category of acute cough. Next, we will talk about subacute cough. Subacute cough occurs between 3 to 8 weeks. So you should have two important um, things in your mind, that is one is your TB, another one is your bronchiectasis. Okay, TB, pneumonia, bronchiectasis. So these are the three important uh, three important diseases that you have to remember. Okay, chronic cough, anything that is more than 8 weeks, so then you call it as chronic cough. So where you will see chronic cough, you see chronic cough in COPD, asthma, ischemic lung disease, tuberculosis, lung cancer, pneumoconiosis, mesothelioma of lungs, and upper airway cough syndrome. So anything that is more than 8 weeks, so first thing you should think about COPD, asthma, ischemic lung disease, tuberculosis, lung cancer, pneumoconiosis, mesothelioma of lungs. Okay, so that's all about cough. Then your viva, what will be your next viva? They will ask what are the different coughs that you know, what are the causes of dry cough. The causes of dry cough is always a pleural disorder. Okay, so pleural disorder or any disease that is present in your interstitium, and other one is mediastinal lesions. Okay, next, what do you mean by productive cough? So whenever there is a productive cough, you have to remember suppurative lung disease and airway disease. And whenever there is brassy cough, metallic sound that is due to compression of trachea by a intrathoracic space that is occupying lesions or aortic aneurysm, also known as a Leopold growl. Bovine cough, where you hear bovine cough, so any tumor that is pressing over recurrent laryngeal nerve, then you will find a bovine cough. What about paroxysmal cough? You can see paroxysmal cough in chronic bronchitis, foreign body, bronchial asthma. What about barking cough? Barking cough you will see in epiglottitis, croup, and hysteria. Okay, so next is your expectoration. And what is the normal range of expectoration? It is about 10 to 15 ml per 24 hours. When do you call it as bronchoria? When the production of sputum is more than 100 ml per 20 tablespoons, then we could teaspoons, then you call it as bronchoria. So where you will see bronchoria, you will see in these three important conditions. One is bronchiectasis, lung abscess, carcinoma, another one is organophosphorus poisoning. Remember, bronchiectasis, lung abscess, bronchoalveolar carcinoma, organophosphorus poisoning. So whenever they are discuss about expectoration, you should remember normal is about 10 to 15 ml per 24 hours. Bronchuria is more than 100 ml per 20 tablespoons. So you can see in bronchiectasis, lung abscess, bronchoalveolar carcinoma, and organophosphorus poisoning. Okay. Next, in sputum production only. So, what is the quality of the sputum? So, it can be mucoid, mucopurulent, or purulent. So, when it is mucoid, then what you have to think? Bronchitis, chronic bronchitis, and bronchial asthma. If it is mucopurulent, remember mucopurulent is always infectious. Purulent, where you can find purulent in lung abscess and bronchiectasis. Likewise, where do you find rust-colored purulent sputum? Pneumococcal pneumonia. Currant jelly and sticky sputum? Klebsiella pneumonia. Blood-tinged foamy sputum? Pulmonary edema. Greenish in pseudomonas. Granules or yellow or black actinomycosis. Then likewise, anchovy sauce, brown color sputum, where you will find amoebic abscess. Likewise, black color, where do you find carbon particles that discolors the sputum. Okay, then you have odor. So foul smelling sputum, where do you find? You find in anaerobic infections seen in lung abscess. You should remember two important conditions. One is lung abscess, another one is bronchiectasis. That's all about the cough and expectoration. In the next symptomatology, I'll be telling about hemoptysis. Okay.